I'm just trying to think what pills I took first thing this morning. I took some probiotics for my tummy. I took some vitamin C because winter's coming. I took a general sort of healthy pill. And then I took a pill, I took omega-3, because I take them morning and evening because I'm neurotic about my brain. And what else did I take? Well, I can't remember, but that's more or less what I took. And we've got somebody sitting opposite me, and that's Allison Vienings, who is the director of the Self-Medicating Association of South Africa. And she's here to talk about top mistakes we make when self-medicating. But I wasn't self-medicating. I was doing preventative medicine this morning, wasn't I?
Yes, you were.
So the difference between preventative medicine, i.e. enough omega-3 fish oils, enough vitamin C so that I don't go down with a cold or something horrible over winter, that's totally different to when you've got a headache or when you've got sore limbs or you've got an upset tummy and you actually treat yourself. Or depression even.
Yeah, so that's actually self-medicating.
Yes.
Whereas what I'd like to talk about is self-care.
Okay.
And, you know, if you want to know why self-care is important.
Well, what is self-care and how does that differ from self-medicating?
I will get onto that a little bit later. I think possibly what we should say is why self-care, what self-care is and why it's important.
Okay, all right.
Okay. So self-care focuses on well-being. So it isn't only the absence of disease or infirmity, but it's a state of complete physical, mental, emotional, spiritual, and social well-being. In other words, it's our physical fitness state, it's our emotional state, it has to do with the relationships with our family, friends, and colleagues, and it's the steps that we take every day and to stay healthy and to take care of our minor or long-term conditions, based on knowledge, based on education and professional advice.
Okay.
The World Health Organization concentrates on non-communicable diseases, and those are heart disease, stroke, cancer, chronic respiratory diseases, and diabetes, and they're the leading causes of mortality in the world, and they account for 80% of deaths.
But with all of those, people will try to self-medicate, won't they?
Absolutely, yes.
So
they will still, and it's very important.
So you can self-medicate for depression, for stress, and other psychological issues, can you not?
It's not advisable to self-medicate for depression. That's one of the biggest problems that people make, is that they self-medicate the wrong conditions.
Okay, but I mean, for instance, lots of people take St. John's wort for depression.
Yes.
You're saying they shouldn't?
They should. They can. But depression is not the kind of condition that one should actually self-medicate. It's a lot more serious than that.
Okay, but so let me get this right. You're saying that you should not take the St. John's wort.
You can take St. John's wort.
I know you can, but should you?
There is actually a product which has been registered for depression, but it's not the kind of condition that one should self-medicate.
Okay.
And that's one of the mistakes that people make.
Okay.
Is that they actually try to self-medicate for conditions that actually need professional healthcare intervention.
So what do you think that you should be taking, for self-medicating? Where is self-medicating in your book?
Okay, there are a lot of many conditions that you can self-medicate. And some of these are, for example, diarrhea, asthma, constipation.
How would you self-medicate with asthma, though?
Once your condition has been diagnosed, the medications that you can use.
Oh, I see. You mean
chronically. So a lot of these conditions are actually chronic conditions, like asthma, diabetes, and so on. And once you've been diagnosed, then those can be self-medicated with over-the-counter products.
So you're not talking about mild painkillers or things that are going to help an upset tummy. You're talking about being given stuff by medical people.
No,
is that
not
what you're
necessarily.
Saying? Okay.
Not necessarily. I think one of the biggest problems that we make is a lot of people do self-medicate. If you look at what happens in the developing world, 80 to 90% of the medications that people take every day are out of the pocket medications, so they come from out of the pocket. The problem is when people are not educated or informed enough to take the right medicines. So even self-medication, it's very important to use it with healthcare intervention. Most of these products are sold in pharmacies, and the pharmacist is always available to assist when you're not sure what you should take.
See, I don't know the pharmacists always do that. I mean, I sometimes think that they're impatient, and I think that people would then rather go and use a simple painkiller or something like that. It's not necessarily going to harm them at all.
It's not going to harm them,
yes.
But are they treating the clinical symptom? That's the problem. So if you have a headache, a persistent headache, for example, if you just have a headache, a pain pill will help. But the problem is when you have a persistent, ongoing headache.
Yes.
That's when you should seek advice.
Yes.
Because it could be something worse.
And then you will self-medicate because you'll be given a prescription, in other words.
That's correct, by the pharmacist.
So it's not actually going into the garden and getting something that is going to help you prevent migraines.
Absolutely.
But because some of those actually do work.
They do work, but that's not what we're talking about.
Okay. So basically, we're saying that self-medication is, if I have an asthma attack, I get out my asthma pump, I take medicine in the morning to prevent an asthma attack, but I administer it myself.
You administer it yourself.
You're talking about that. If there's a migraine, you will have already seen a doctor. You'll be given the migraine pills. When you feel a migraine coming on, you're going to pop a pill.
Self-medicate yourself.
You know.
Yes.
So, I mean, is there any controversy about this? I'm just wondering, because it's such sense that we're talking about. There's no controversy about this.
No, there's no controversy about it at all. As a matter of fact, SMASA are advocates of self-care, which involves self-medication, because when consumers take the initiative for looking after their health, they're in a much better position to take charge of their health.
Yes, but always you do find that sometimes homeopathic medicines, sometimes you do find that some of the old cures, a few of them, not many, that they work. They've been proven to work just as well as something that you spend a great deal of money getting the doctor to give you.
That's correct, and that's where we're going. Is that there are so many instances where people can actually self-medicate themselves to avoid the healthcare costs when it's not necessary. So to be able to treat yourself for minor ailments, they can be acute, they can be chronic, and they can also be minor without going off to off to the doctor all the time. Well, we're not saying don't go to your doctor. What we're saying is, if you look at what Nicholas Hall says about the healthcare system, they describe it as a pyramid upside down. So they describe that as the burden on the healthcare system, where you have this huge burden on a very small support base. And, it's important that people actually start becoming educated and starting to take responsibility for their health.
All right, well, give us a call, 883-0702, if you've got any questions, and you can SMS me as well, 31702. Standard SMS rates do apply. We're just talking to the director of the Self-Medicating Association of South Africa, that's Allison Vienings. And I'm chatting to the director of the Self-Medicating Association of South Africa, and that's Allison Vienings. And Allison, I was getting on to talk about cancer, because I think if ever there is an illness or a disease or whatever cancer, the category that cancer falls in under, I think that people go onto regimes. They go onto their own health regimes. They read widely. I think it's self-evident that you've got to eat food that is as pure and as simple as possible. I think it differs depending on the cancer that you've got. But I know many, many people who self-medicate in that way, and they actually don't go through a doctor. They'll go for oxygen treatment, which is pretty well proven. So what are we talking about here?
I think probably the most important danger of self-medication is when people don't recognize the symptoms of more serious ailments and inadequate knowledge. As you say, people with cancer do a lot of reading. They do